Warahmatullahi wabarakatuh. Is there anyone on? Or shall I just get started? Okay, Bismillah wa salatu wassalam ala Rasulillah, Muhammadin ibn Abdullah wa ala alihi wa sahbihi wa man wala. In the name of Allah, the most merciful, the most gracious, may peace be upon our Prophet Muhammad sallallahu alaihi wasallam, his companions, and all those who follow him till the day of judgment. Do you have any kind of indications to see? Shall I get started or not? Or shall I just get started anyways? I'm just waiting to get a sign. Okay. Okay, so I get started. Okay. Tamam. I guess that's a yes. Okay. Shall I start talking? Okay, Bismillah ar-Rahman ar-Rahim. Let me get started again. Bismillah wa salatu wassalam ala Rasulillah, Muhammad ibn Abdullah wa ala alihi wa sahbihi ajma'in. In the name of Allah, the most merciful, the most gracious, may peace be upon our Prophet Muhammad sallallahu alaihi wasallam, his companions, and all those who follow him till the day of judgment. This is Nadia Iblagh with you. I'm a teacher in IPC, and I'm also a trained instructor from American Heart Association, and part of the courses I give is first aid and CPR. So today I'm going to speak a little bit about first aid and a few tips and a few tips that may help you if you're a mother, if you're working in a shop, if you're working in a house, or if you're working in an office. There are certain things that you may need. So why do we need first aid? Of course, we have in Islam, or as human beings, we are always we may always have in front of us incidents that we may need to work fast to help someone or to save lives, whether it's at work, or whether it's at home, or whether it is in the street. And as human beings, we may need to save other humans, or even other animals. Okay, and from the believer's perspective, first aid training is valuable skill to have in one's to be skilled upon. As we have living standards improve, and as we see certain trends and diseases which may precipitate in a medical emergency at any time. We may see strokes, we may see children falling down, we may see children or even elders needing help, either choking in a restaurant or at home, or and there are certain things that we can do that can help them save their lives or not. And in Islam, of course, it is not only that you get the reward in this world, you get the reward for it even in the hereafter. So it's an eternal reward when we save others' lives. So looking at from a perspective of a Muslim, we see that it is an obligatory to help someone when we can, and it is also a reward for us, because Allah subhanahu wa ta'ala says in the Quran Kareem, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever, I'm just trying to see the translation, this is in Surah Al-Ma'idah, Ayah 32. And he who saves one life, or whoever saves one's life, is as if he has saved all of the humanity. So when we save someone's life, don't only think about it in daily rewards of helping a beloved or helping a passenger, but also that you are taking a reward, which you will see the reward of it in the day of judgment. So it is an eternal blessing or eternal reward you will get. So why do we need first aid? We need first aid for basically for three goals. Okay, the first is to preserve life, as we know that one of the things that in Islam is really, really important is to preserve life. It's called the five necessities of life. Okay, and I'll let you know all of them by the end of today. But one of them is preserving life, preserving progeny, preserving money, and preserving the honor of human being. So here we are preserving the life. So it is important that we know that it is part of our duty in this world that we preserve the life of people or even ourselves. Not only helping them preserving their lives, also preventing them from further harm. So if you help someone at the right time, it will help them not only, it's not only death or life, it's also that life vs a better life. So someone may live, and we believe that whenever is your last day, Allah has written it for you. Okay, it is your ajal, it is your day. But what's the quality of life that you will live till that day, or the person you help may live? I may live for 10 more years, or I may live for 2 days. If I live for 10 more years or 20 more years, I want to live a quality life. Okay, so if I have someone living for 20 years, do I want them to live paralyzed, or do I want them to live a quality standard life? So preserving the life, preserving from further harm, and promoting recovery. Why are we saying this? Because they are in everyday life, in every day, in every year, around 735,000 people just in US, okay, are suffering from heart attacks, or in Europe, like road traffics, which we as human beings who are there, who may be in front of our eyes, happening in front of our eyes, we can help them save their lives, save them from further harm. Okay, so there could be sudden cardiac arrest, there could be chokings, there could be any kinds of emergencies that we can help, as long as we have a little bit knowledge of first aid. So the session's objectives today is to recognize the benefits of obtaining first aid. Why is it important that I know the first aid? As a mother, as a father, or a parent, as someone who works in wherever you work at a home, you work at a hospital, you work anywhere, or even as a passenger in 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 the street, and to identify proper procedures for a variety of medical emergencies, and assist in administering first aid when someone is injured. Okay, and to learn not to harm yourself or to harm someone else when you're trying to help them. Sometimes we try to help someone, and instead of making things better, because we do not know what to do, we may make things even worse. Okay, so not to harm anyone uh, with good intention. Okay, so the first thing that should come to our minds, that um, when I'm helping someone, usually when we see an incident in front of us, we see that we think about helping the person. But you may be surprised that I will tell you the first thing you have to think about before helping the other person is to make sure that you are safe. Because if you are not safe, then you cannot help anyone. So the first thing is, if a person is the immediate thing about helping someone is to make sure that you protect yourself and you protect the person from you. And as we've known for the last few years, this year and the previous year, and the year before, we had COVID, and before that, we had other diseases. So the first thing you have to know is that to think about is to protect yourself from them, So maybe the person is victim, maybe he has COVID, maybe he has another disease that could come to you, or vice versa, or other way around. You're protecting yourself or you're protecting them from yourself. In both cases, you have to know that you have how to be safe while you are helping others. Okay, so we're going to learn a few things. I'm going to talk about today is how uh, to deal with an incident in safe way, with um, being safe in using the safety precautions. Okay, how to wear proper gloves, how to clean your hands, how to take off the gloves, and how to make sure that the person in front of you is protected from you and you are protected from them. And we're going to talk about there are certain emergencies like choking, someone who needs a CPR, burns, and how to do bandages. So we have 4 basic rules. Evaluate the scene. So if you see someone falling down, okay, if you see someone has falling down in front of you, obviously what people usually think is that they would run to the person to help them. So if I see my victim in front of me, the first thing I would think of is going to the person and saying, are you okay? But that is not the case. The first thing you have to do is to make sure that you are safe. Evaluate the scene, check if the scene is safe. Check if the scene is safe. So I look around. Why is it? Because why is it important to check the scene is safe? Because if the person is lying down, maybe here or here or here, there is electricity. And as soon as I go approach the person, okay, the electricity may hit me and I may be the second victim. So it is really important that I make sure that before I help, I know I look around, maybe there is gas coming from up, there is electricity, maybe there is water, I don't want to slip. So make sure that if it is to do with electricity, you put the main electricity off, and then go help the person. Assess the safety, make sure you know who to help first. If you have few people around you and all of them are victims, who will you go first to? Think about it. If you have more than one person, who will you help first? Of course, the person that is screaming, the person that is um, shouting, the person who's showing some kind of disturbance, you don't go to that person first. The person who is quiet and is not moving, that is the person who needs to be prioritized and helped first. Okay, I'll say it again, because as long if there are 2 or 3 people and one person is not moving and cannot even shout or scream, and there are the other 2 people who are shouting and screaming and asking for help, the person who's quiet, he's the one who needs help. Why? Because able to he's not even able to talk or ask for help. So prioritize. You take few seconds to look around first, make sure the scene is safe, and then you go to the person, talk to them. Are you okay? Are you okay? Or see who needs you first. The person who cannot respond is the first person who you will need for help. Okay, move on. So first thing I did was check the scene is safe. Are you okay? Are you okay? Now, the person who is on the ground or the person who's sitting and he needs help, you have to make sure that if he's an older person, that you ask for if they need your help. If she says to you, do not help me, do not help them unless they are unconscious. Okay? So now, let's talk about if you are working in a house or if you're working in a school as a teacher or if you're working as any admin work in school and the child is choking. So let me take first the choking child. Okay, so I am talking about a 5-year-old child choking. Okay, so how will you help a 5-year-old or elder a child choking. So I'm talking more than 1 year old. Choking means that there's something blocking him from breathing. First thing, if the child is talking, then it's good. Then he's actually in good in a good state, because the person who's really choking badly or choking will not be able to talk. So if you see them tell you, help, help, I'm choking, be happy, because that is something really good. Now, if the person is not talking, but you know that he's suffering and he does this with no sound, okay, and he's having his hands here, then the person is, it's 5 year old or 4 year old or elder, then the person is choking. Or you see them eat something and he's trying to make a sound, but he cannot make a sound. In this case, what will you do? So this is a 5 year or elder child, okay? So what you will do is you put your hands over their stomach, okay, around their stomach, okay, and you put your fist on the belly button, which is here, okay. You put your fist like this and you will push inwards and upwards, inwards and upwards, okay. Now, in that case, the child, whatever he has will come out, and he will be able to talk, and he will be able to breathe. Do not put your hand inside their mouth, because it may, instead of coming out, unless you can see that you can take it out, but blindly putting it inside does not help by any means. Do not give it a blind, yes, swap. Don't put your hand, if you see. The best way is put your hands around their what do you call this place? Okay, their belly, and put the hands like this on the belly button, the little button you have here, and you push inside and upwards. Okay. Okay. Now, if even if it is an elder person, an elder man or a woman or whoever, as long as you put your hands on them and you press inside. Okay, we said there the sign is like this. Okay. Now, if you're alone and it happens to you, what can you do? If you're alone and you feel you're choking and you cannot talk, obviously you cannot shout, in that case you will go to the nearest table and try to do the same thing and push yourself against the table to make sure whatever blocking the way, it comes out. Now, if it's a child less than 1 year old, if it's a baby, let's say less than 1 year old, so you have a little baby and he started choking, you put him on your lap. You put him on your lap, okay, and you would make sure that you put your hands like this and you give him 5 slaps. 1, 2, 3, 4, 5. Make sure you do not cover the mouth, and you put him other side and give him 5 um, thrusts from here between the nipples. Between the nipples. So 1, 2, 3, 4, 5. It's all on your lap. And 1, 2, 3, 4, 5. Okay. Until you keep doing this, 5, 5, 5, 5, 5, 5, 5, and make sure you do not break his head. Put the hand like this, okay? You're actually making sure the neck does not go like this. And when you change your hand, it goes like this. Of course, I would really like you to take a first aid course where you have to take the course face to face, so you can practice with our dolls or our mannequins how to take the child. But just for now, I can tell you, make sure that the head is being supported. And when you change your hand, use the same hand. Don't change your hand like this. Same hand and let it go. like this. Make sure you don't cover the face, you don't smash the eyes. This is just a doll. Just make sure that you don't cover the mouth. It's like this, and you're giving 5 thrusts. Clear? Okay. So I am back. Assalamu alaikum. So I was talking about how to make sure that everyone is Assalamu alaikum. Sorry for the inconvenience. So can you hear me now? Okay. Okay. So I was talking about the infant, or the infant, how to, if he chokes. Okay. So what if he chokes the infant? So we are talking here about a baby and not a child. A child is like from like more than 2 months till 1 year old. This is, I'm talking about a baby. So if we now, if there is any question, please write in the comments. Okay. Okay. Sorry for the inconvenience. We are going to talk about next part. I'm going to talk about what if someone has uh, convulsions, or someone is uh, having attacks. Okay, I'll just go to the next part. First of all, before I go to the next part, what is the number of emergency number in Kuwait? I hope you know that it is not 911, it is 112. In Kuwait, the number for emergency is 112. Make sure you note it down, and so that whenever you need it, and inshallah you will not need it, you will know that it is 112. It is okay to call. It is okay to call the uh, uh, 112 by mistake, and you think someone is not well, but he's well, rather than being wrong and he needs help and you do not call them. Make sure that you know the number and you put it in a big, in an A4 paper near the door, or somewhere everyone can see, so they know that they should be calling 112. Okay. Now, what if someone is, so we talked about the choking for the child, and we said do not put your hand in the mouth blindly, because instead of helping the person, you may make things even worse. Now, what if I have bleeding? If I have bleeding, and if I'm working at a home, or as a teacher, or working as a teacher or a caregiver in a at home, or in a hospital, or in a school, anywhere, and you see someone bleeding, let's say that my hand, I have a cut here and I am bleeding, how will you stop it? If you have running water, you will go and put the hand under running water, because whatever may be the cause of this cut may be not clean, and because the knife or whatever that gave me the cut is not clean, that's why if I have running water near me, I can go and put it under the running water before I do anything. And then I will take some uh, gauze, which is this. I don't know where to see this. Okay. And you will put it over the cut. And I have this cut. I will put it here and I'll press hard on it. Not as much that my hand will get um, blue, but so that I can feel the, um, when I press. Now, if this gets full of blood, I will not take it out and put it outside. No, I will not take it out, because if I take it out, the bleeding will start all over again. I will just put more gauzes until I feel it is enough, and I'll put more and more. And do not remove it, because once I remove it, there will be clots, and it's trying to close the place. And when I remove it, it will start bleeding again. So even if it's full of blood, make sure that you press, but do not take it out unless you're sure that completely it's stopped. Now, how am I going to close this uh, how am I going to leave it? I will may need to leave it for a few times. So this is the bandage, and this is the gauze. Okay, so I'm going to put it here, put this side a little bit longer. Okay, and I'm going to press hard and try to cover the injury. And I will either tie it or put, if I have the clip, put the clip. Okay, until I know that it has stopped, like an hour or two, or maybe depending on how much injury you have. Great. Okay, if you have any questions again, please let me know. Okay, now, so again, if I have bleeding, it could be of two types: internal blood inside or external outside. External is outside, you can see blood, you can put your hand, you can help the person stop the bleeding, or even yourself. Okay, now the problem is that if the bleeding is too much, or maybe I have a bleeding on my hand, okay, here, and it's so much that you cannot stop it with a gauze or with a bandage. So what will I do? In this case, I'm going to put as much. If you don't have a gauze, and let's say you are in a car, or you are in desert, sometimes you're going for a picnic, in anywhere which you don't have a gauze and you don't have the first aid kit, you can take your hijab and break it and try to make it, tear it, and um, make it, and use it instead of the gauze. Okay, so if it's in a place such as this here, and the bleeding is so much, then what you will do, the same steps I told you, but instead of just covering the just tying the place very tightly, I would rather use a tourniquet to stop the bleeding. A tourniquet is like, if the bleeding is here, let's say here, I'll put, if it's here, I'll put it here above it, like few centimeters, and I'm going to stop the bleeding. I don't know if you can see this with this. So I get really tight to, I tie, so I can try to stop the bleeding. Okay. Again, make sure that whatever you're using is clean, and the place is kept clean. Now, if you don't know the person and he's not part of the family, or if you don't know if he has a disease, you have to wear your gloves. Make sure you know how to take the gloves off. Okay, so now that I have a person who's bleeding, I don't know, maybe he has a disease and I don't want to get it into me, so I should be wearing my gloves before that. And after I finish work, I take it out like this. Okay, I don't put my hand here because this may be full of blood, and I put my hand here and I get contact with the blood. I will, if both my hands have gloves, okay, I'm going to let me just wear a glove. Okay, and I'm going to take it out as such that I do not touch my skin with the hand that has the glove. Okay, now if it's internal bleeding, obviously I will not see. In that case, if that would be the case, if someone has fallen from first floor, second floor, and he had an injury in the head, or something hit him, then there may be internal bleeding. Okay, the internal bleeding In that case, the person may feel dizzy. If someone falls down or someone had an accident and you don't know if there's bleeding, make sure at least you stay with them for half an hour before you leave them alone, because at the beginning he may not feel, he may look okay. Okay, in case the person is feeling, so he had a, let's say he had a injury in his um, stomach, somewhere here, make sure that you put or he had here, he had his leg broken or anywhere inside, make sure that, and even if you have a little doubt that there may be internal bleeding, just take them to the doctor as soon as possible. Better safe than sorry. If the person feels dizzy, make sure you lay him down and put his feet up 5 centimeters, and on the place he has uh, pain, you put cold water or ice pads on the place. Yeah. Okay. Now, what if someone cuts his hand or a part? So the hand is cut or the fingers are cut. So if you're working, if someone is working in a kitchen, for example, and they by mistake they cut their finger and the finger part just went across to and out, detached from the body. In that case, make sure that uh, first of all, if it is inside, let's say if this is a knife and it gets inside, make sure you do, if it's let's say it's in the body, make sure you do not take it out quickly. You leave it, if it's really deep, leave it as it is, and make sure you secure it, and take the person to the take it to the hospital. Make sure you do not take it out if this is, if you had a knife or something inside. However, if you had part of the body amputated or detached from the body, let's say the finger, make sure that you take the finger. First of all, make sure the scene is safe. Remember, wear your gloves. If you see someone, wear your gloves, and take the person, put his hand under the running water, and from the running water for like few seconds, like 20 or 30 seconds, and then you cover, as we said, you cover the place with the bandage or with a gauze, okay, and press it hard to stop the bleeding. If you need a tourniquet, as we said, use the tourniquet. Otherwise, take the person to the nearest clinic. What about the part that was amputated, cut away? You take that part, wash it under, um, wash it under the running water, okay, and um, wash it under the running water, and put it, cover it by a gauze, okay, put it in a um, bag, plastic bag, put the plastic bag in another bag which has ice, okay, and write the name and and the date, and take it with the person to the hospital. Okay, make sure you do that. What if someone has bleeding, nose bleeding? What will you do if someone has a nose bleeding? Before, we used to tell people to put the person, the victim, up, but now we say that you put, make him sit somewhere, press the from two sides, make him uh no, the other way around. Okay, what if the person is bleeding? Okay, before we used to tell them to do this, because it now, because if you do this, it will go to inside and you may drink the blood. So we are asking them to make sure to put their head down and press the two sides of the nose very hardly. So, okay, hardly from these two. And if it did not stop for a few seconds, then a few minutes, then it means that the person has to be taken to the um, hospital. Okay. Okay. What if the person is has some burns? Okay. What if the person has if the so there's different types of burns. First of all, if the person is if the child is being burned a lot, like there you can see the burn on his clothes, put him on the ground, okay, and then put a blanket over him, okay, and let him roll. Stop, drop, and roll. Stop, drop, and roll the blanket on him and let him roll, okay. If it is in his hand and he has something and the person has a um, ring or something wearing, make sure he's wearing something, make sure that you take it out before you do anything, okay. What you will do is you put the hand, if it's the hand, you put it on cold water, okay, and I'm not talking about ice, on cold um, cold water, and for like 10 minutes, okay, and let until you feel better. So the first one was the person was burning and you could see the burns and it was in his clothes. If he has clothes, you'll take the clothes off. If he has anything, you take anything out because you don't want it to stick on the body. If, for example, my hand or my some places are burning, make sure that if there are any accessories, remove it and then put it on water for um, for 10 minutes. And if it's private places or the face or the neck, do what I just said, but as extremely um, fast. Take him to the um, take him to the clinic or to the hospital. Okay. Now, so here are the burns. We talked about choking. We talked about burns. We talked about babies choking. We talked about, now let us talk about epinephrine. I don't know if you know anyone who has epinephrine. Some people have epinephrine pen. Some people have really serious allergic reactions. Some children or some elders, if they, for example, take nuts, they will have extreme allergic reaction. These people usually have something called the epinephrine pen. It looks like a pen, and it is all that you have to do is that you should know that the person is allergic. So if you have someone at home who is allergic, an elderly, a younger, a baby, or just an adult, make sure that you know how to use the epinephrine pen. Make sure that everyone in the house plus the patient knows how to use the epinephrine pen. Now, I'm not talking about the normal allergic reactions where you have rashes and you start becoming red and you start itching. I'm talking about serious allergic reactions. In this case, they usually have something called epinephrine pen. Epinephrine pen is called because it looks like just like the epinephrine, just like the pen. The epinephrine is just like the pen. You just take the cover out, okay? And when you take it out, you'll see the needle coming out. And you put it on their leg, on their thigh. So not my hand, my thigh. And you'll just over the clothes. You don't have to take the clothes off, okay? For 10 seconds. 1, Kuwait City. 2, Kuwait City. 3, Kuwait City. 4, Kuwait City. 5, Kuwait City.
6 Kuwait City, 7 Kuwait City, 8 Kuwait City, 9 Kuwait City, 10 Kuwait City, you'll take it out, rub the place, and sit with the person until he gets better. Then you'll take him to the um, you'll take him to the clinic. Now, what if if a person faints? If a person faints, there are so many reasons why they may faint. Okay, part of it may be that maybe he have bleeding, maybe he has low um, blood pressure. We don't know the reason, but what we can do, we know, is that he's fainting. In this case, okay, make sure that you make the person lay down and put his leg a little bit above. What we are trying to do here is to preserve his brain. Okay, make sure the scene is safe. Make sure the person is on safe, flat place, and put the feet up. If the person did not get better, call the emergency. And the emergency number is 112. Okay? Now, if you have someone who is diabetic, high sugar level, what will you do? Now, we don't know if the person who's diabetic, his sugar level is up or high, unless we know we came from a party, we came from a gergean, or we came from somewhere we have just ate. Sometimes we don't know if the person has eaten or anything, is it up or is it low. Now there is a general rule. Usually the people who are diabetic, they know if it's high or it's low. Now, if the person's sugar level is high, he has time. Now, the problem is if it is low, he has no time. So, if you see these um, indications, or then if you see these indications, then make sure you give him sugar. It's very easy to increase someone's sugar level. If it's low, it's dangerous, but it's easy to let it to help him maintain his sugar level, or make increase his sugar level, and then take him to the clinic and let the the medical professionals, they do their job. The problem is that if you do not know if it's either high or low, and the person in front of you is confused, then take it as if it's low, because as you said, low sugar level is a big problem. Okay, so you would give him a chocolate, a date, water with honey, anything, but don't give him diet Pepsi, for example, anything that would quickly increase his sugar level. Okay, the person may feel dizzy, the person may feel confused. If you ask him a question, he can hardly answer you, and so on. Now, yes. Um, any questions? Let me know. So we said if the person is having seizure, he's moving very, I don't know, he's moving, um, having seizures, he's not controlling his movements, then what do you do? The person who has electricity on his mind, and some people, they think it's epilepsy, or they call it epilepsy, it could be from any other reason. It could be epilepsy, it could be any other reason. But if the person have tashanujat or seizures, then what will you do? Some kids, some children, if their um, body temperature gets high, they get it, and there are other reasons. In first aid, we do not look for diagnosis, we just see what we can do. Okay, so it could be many reasons, as we said. And the seizure attack may be a few minutes, and it may just go, and the person may have his fluid from his mouth and from his nose and other parts of the body. Don't try to clean it while he's having the attack, or while he's having his his seizure attacks. Wait till it ends, and then usually the mothers or the caregivers, they try to clean the person, especially if it's in a mall or in front of people. Just leave him alone. At this moment, you cannot do anything. Don't stop him. Don't put your hands on his shoulders to stop him from the seizure. Let him take it, but remove anything around him that will cause injury to him. He may hit his head on a table. Remove the tables. Remove the desks. If there's anything sharp around him, remove it. Okay. Do not touch him. Do not stop it. Okay. It will go. Keep yourself from panicking. Keep it calm. It started by itself, it will finish by itself. After he finishes or she finishes the attack, then you can start cleaning him, put him on his side. After he gets up, he will not remember anything. Don't try to remind him of anything also. Some people, because they have the tongue out, the victim have the tongue out, to try to put it in or put something in their mouth to um, stop him from cutting his tongue. It's better to for him to injure his tongue than putting something in his mouth. Okay. So as we said, make sure the scene is safe. Put your gloves on if you don't know the person. Make sure you remove the furniture or anything around him, and just wait without panicking till he gets better, and then you put him on his side. So usually be like this and he's moving. Just when he finishes, just put him on his side. Okay. And then if he doesn't get better, call the emergency number 112 and talk to them. Now let's talk about how to call the emergency. Calling the emergency 112 is really important, that you tell them exactly where you are. Okay, because sometimes if the person is not responding or very critical, those few minutes that he may waste his time will be the reason of not saving his life. So if I am going to going to call the emergency 112, make sure you tell them exactly where you are. For example, if I say I'm in Jabriya, I'm in Jabriya, which area? Area 4, uh, which street, which house number, which floor, which room. Or if I'm, let's say, in a school or a caregiving in a nursery, which floor I am, and if I go to the second floor, left or right. Of course, when you're panicking, you may forget these things. So the best thing is that wherever you are, you just put the emergency number. Okay, you put the emergency number, also right where you are. Okay, so I have a note like this, and it is on the wall. So may Allah forbid if I need it, and if I get, sometimes I remember when I once called once called the emergency. Instead of saying Jabriya, I told them Hawali, or I told them Bayan. But then if when I have it in front of me, I'm just reading. I'm in Jabriya, this street, this. So write it in a paper and put it somewhere clearly. Do not hang out if unless the dispatcher tells you. After you finish, if you're at work, if you are at school, wherever you are, if you're not at home, make sure you have a paper to write what happened. So next time, so first of all, you documented your work, you get the credit for helping someone, and thirdly, Sometimes they come at the end of the year to see the incidents. They find out that there's a problem, let's say on grade 2. They will find out, or grade 3, or grade 4, or second floor, or the library. They will find out if there is a problem coming from, problem in the ground, or problem from the AC, or whatever. The documentation always will help to improve things. So anyone has any questions? So this was um, because it is today is the day of first aid, lifelong first aid learning day. We would like to encourage you to take the course online or take it offline, hands on. We would really like you to take the course hands on and go to cpronline.com to see how to do the um, resuscitation. I'm going to lastly tell you how to do resuscitation for babies. If the baby does not, or elders does not respond, he's not moving, he's not breathing, and there's no pulse, then what will you do? You will put the baby on the firm ground, okay, not a bed, on the ground, okay, and you will try to see if he's responding. You'll say, are you okay? Are you okay? If the person is responding, it means the baby will start crying. But if not, what will you do? You put him on a firm ground, and you put your fingers between the two nipples here, and you will start giving CPR. 1, 2, 3. The pushing the chest. 3, 4, 5, 6, 7 till 30, and you give 2 breaths. 30 to 2, 30 to 2. Now, because of COVID, we used to tell them, do not give breaths, just give this, and meantime ask someone to help. So these are giving CPR. Let me put them in proper uh, order. First of all, you see the baby is not responding. Are you okay? Are you okay? Are you okay? Are you okay? She or he is not responding. You put him on the firm ground. If there is someone, you ask them to call the 112, call 112 and the emergency, and to ask for help. If there is no one in the same time that you are doing CPR, you're going to call 112 and going to talk to the emergency and give him 30 thrusts and 2 breaths. 32, 32. If you're not going to give breaths because you don't know if the person you don't know the person, or you're not the mother, you don't know anything, then don't give, to be safe, don't give the breaths, but give 30. um, uh, Press the chest with your 2 fingers 30 times. You'll do 30 to 2 ratio of giving breaths and thrusts till 5 cycles. If you're 2 people, the other person after 5 cycles will start giving CPR. If not, you continue till the emergency or the ambulance comes. Okay? So every time you're helping someone, you make sure the scene is safe. You don't want to be the second victim. Ask them if you want to help. If the person is not conscious, then you cannot. Then you assume that he says yes, help me. If you have gloves, wear your gloves. If you don't know the person, don't give him mouth to mouth breathings, and protect yourself and protect them. Any questions? Walaikum salam wa rahmatullah. Walaikum salam, Salidat. Walaikum salam, everyone. So, any questions before we end? I would like you to go to YouTube also to check the first aid. I would like you to take the course if you can at home or at work. We always need these, and we can be a reason for someone's life or better life. Jazakumullah khairan. Thank you for coming. If you have any questions, let me know. If not, we'll stop here. See you inshallah next time. Assalamu alaikum wa rahmatullahi wa barakatuh. Ameen.